Hello, my name is Disha Upal and I work with the Philadelphia Autism Project. Today, I will be providing you with a broad overview of autism spectrum disorder. In this brief e-module, we will address some of the most common myths and misconceptions people may have about autism and share resources related to these topics. As you may work with families with young children, it is important to be aware of this information so that you can best support the families which you serve and provide them with evidence-based resources and information. These are the topics that we will cover today. So what is autism spectrum disorder? Autism, also often referred to as autism spectrum disorder or ASD, is a developmental disorder which affects social interaction, communication, and other behaviors. It is usually diagnosed in early childhood and can be diagnosed as early as 18 months. Some people on the autism spectrum can have difficulty making friends, they may face language delays, find it difficult to maintain eye contact, may find it difficult to transition between activities, or cope with unexpected changes in their daily routine. People on the spectrum may also engage in repetitive movements, such as rocking back and forth or pacing around a room. Additionally, sometimes people on the spectrum may be hypersensitive to the environment around them and have increased sensory needs, meaning they may be negatively affected by loud noises or bright or fluorescent lighting. It is important to keep in mind that people on the spectrum have a wide range of skills, needs, and challenges. Autism spectrum disorder is called a spectrum disorder because it affects each individual to a different degree. Remember that these symptoms do not always apply to everyone and can look different across the spectrum. They can also look different depending on a person's environment and past experiences. So let's debunk some myths. The first myth, which we will address today, is that only children have this diagnosis. This is incorrect. Autism is a lifelong diagnosis. Children who are on the spectrum will become teens who are on the spectrum, and then adults on the spectrum. And while autism is usually diagnosed in early childhood, there may be individuals who are just receiving their diagnosis as teens or as adults. Keep in mind that as we age, we learn coping, adaptive, and many other skills. So, the characteristics, symptoms, and needs of a child on the spectrum may vary greatly from the characteristics and symptoms you may see of an adult on the spectrum. Adults' needs also greatly vary from the needs of children, and therefore it is very important to plan ahead and connect with resources and services as early as possible. The second myth, which we will address, is that only boys are diagnosed with autism spectrum disorder. This is false. The CDC reports that autism is 4 times more common among boys than among girls. But while boys are more often diagnosed with autism, this does not mean that girls cannot be diagnosed. Girls can be on the autism spectrum too. Research suggests that there is an underdiagnosis of autism in females, particularly due to the symptoms presenting differently between males and females. This means that it can sometimes be more difficult to diagnose females, and that results in less females being diagnosed overall. The third myth, which we will address, is that the parent did something which caused their child to have autism. This is false. A lot of research has been done to explore the causes of autism, and research has found that some risk factors may include genetic and biological factors, parental age, being born too small or too early, as well as complications during pregnancy. Research has also shown that parenting style and vaccines are not a cause of autism. While there is still much research ongoing in this area, to date there is currently no singular proven cause of autism. Next, we'll be sharing some resources. So here are some Philadelphia and Pennsylvania-based resources, which we hope that you can leverage in supporting the families that you serve. We have also included our contact information, so please feel free to reach out with any additional questions or concerns. Thank you.